Well, good afternoon. Hey, I'm Dr. Bill Christenberry at Caldwell Mill Animal Clinic, and this is a second part of our series about heartworms. I wanted to try and educate people that are watching about heartworms, and we previously talked about the heartworm life cycle. And in this section, I want to talk about the heartworm preventatives. We've been using heartworm preventatives for many years. They came out right before I finished veterinary school about 35 years ago. We used Bits, which was a daily product that was revolutionary, that would prevent heartworms, and they had to take it every day, and it did a good job. And then they came out with the monthly ones, which was wonderful because then you didn't have to worry about giving it every day. And that's where we're at for the most part. There's one preventive that is a 6-month injection, but we won't go into reasons why we don't use that as much. The monthly ones are very effective, very easy to use, very safe. That's HeartGuard, Interceptor. Revolution is a topical one that's used. Advantage Multi is a topical one that's used. The HeartGuard and the Interceptor, the Sentinel, those are oral ones, and so those are all effective and work well. So the way that a preventive works is the monthly ones, the way they work is what we call a monthly house cleaning. Now, most everybody thinks that when you give a heartworm prevention, since you give it once a month, it stays in the body and it prevents the heartworms all month long, and then you give it again and it stays in the system. That is not what happens. The medication is basically in the body's system for about 24, maybe 36 hours. And it kills off one stage of the larva of the heartworm to keep it from developing into the adult heartworm that we talked about in the last segment about the life cycle. So it does, like I said, a monthly house cleaning. It just clears out, whoops. It clears out what's in the body on a monthly basis, and then it's gone, and so it doesn't stay in the body for the whole month. So one of the things that we're beginning to see that we're concerned with is our preventives, which is something that we see with a lot of different medications, are resistances. We're seeing that with antibiotics. We see that with humans, with MRSA, the resistant infections that people get in the hospital, and things of that nature. And it happens with dewormers. That's why there's so many different dewormers out on the market, because worms and parasites develop resistances. Same thing with flies, with fly repellents and things like that. They're always developing new ones. Well, unfortunately, we're seeing the same things with heartworm preventives, that there's resistances are developing. And so that's why we have the different ones. But one of the things that's revolutionary, there is a new product out called Vectra 3D. And it is actually a repellent that is used monthly on dogs only, not on cats, and does a very effective job of repelling the mosquitoes and keeps them from biting the dog anyway. Because, as we said in the life cycle, that's how the heartworms are spread, because the mosquitoes bite the dog. And so the repellent keeps them from biting. And so the thought on that is if you can prevent them from biting the dog at all, then you don't even have to worry as much about the oral or the systemic heartworm prevention. And that's not completely true. We found in the research that they both work together very effectively. So we're in our hospital, we carry the oral heartworm preventions and still recommend them. I still use them for my dog, but we're also carrying the Vectra 3D, the repellent, to use as well. And I know that that's a lot of medication. You're thinking, I have to give the oral and I have to do a topical as well. And that's frustrating, because we were using topicals for flea prevention, and then now there's the oral ones, and it's great because we don't have to use those, and don't have to worry about the mess and all that, and that's been great and revolutionary. And now we're going back to saying, well, there's a topical that we're using to repel mosquitoes, and it also repels fleas, and it repels ticks too. So it's a good thing, but it's kind of cumbersome. So we're sort of in the midst of a shift, of a change of how to do the best that we can to prevent heartworms, prevent fleas, prevent ticks, and try to do it in an effective and an efficacious manner and efficient as well. So we just want y'all to be educated about what's out there, what the recommendations are, and we can certainly talk through those things. It depends on your dog's environment, their susceptibility, their exposure to fleas, to ticks, to heartworms, to mosquitoes, and how we would handle that. So we'll discuss that, but we just want you to know what there is out there. So thank you for listening, and I'll see you on the next segment.